So what we do with our program is called the School-Based Dental Prevention Program. And so we see students in the schools, but we move our dental equipment into the school and we see kids one-on-one and we do dental screenings and we check their teeth, talk about taking good care of their teeth. But the main prevention that we want to do is prevent cavities, of course. And what we do is we put protective sealants on their permanent molars. And so your kids, the age that they are, it's so important that we get all those molars sealed up to protect them from decay. And so that's the main part of our program. But a couple of years ago, they implemented a new thing in our program. So we see a lot of students that haven't been to the dentist in quite a while. During COVID, people weren't going to the dentist at all. And so we're kind of seeing the aftermath of all of that. And so there's been a huge increase in decay and all these little kids that we're seeing, like littles, and so, and we'll talk about all that in just a minute, but what we can do also in the school when we see the kids is we can put, it's called silver diamine fluoride, and it's a liquid, it's just like a little drop of liquid that we apply with a little fuzzy brush to the cavity if it's not big. And what it does, it stops the cavity from growing bigger. It kills the bacteria that's causing that. And so it just stops it and it tracks so it doesn't progress any further. And so that's been a wonderful thing that we've been able to do, because before we were just doing the sealants and we wanted to be able to help these kids in the meantime to give them some time to get to the dentist. And so this has really been a good thing that we've been able to implement. This is a permission form that we send home to see the kids, and on the back is all the information that needs to be filled out. But what it shows are the protective sealants before and after, and we place on the tooth because it's white in color and it blends in with the tooth. But it just seals out those real deep grooves from the bacteria, the germs that cause cavities. And then this shows the before and after we apply the silver diamine fluoride to a cavity. It actually darkens it, but it hardens the tooth even more, so it makes it less soft, but it hardens it so it can stop getting bigger, okay? So that's what that is. So when you see your kids, fill this out so we can see them. It's a wonderful program, it's free, and I wish when I was your kid's age that I had sealants put on my teeth, because I feel like it's on my back molars, because I loved sweets, but we'll talk about that later. I still do, but I've had to, watch that. So, but basically, I'm just going to talk about basics of just oral health, and then we'll talk about, I have different aspects of ages of kids and on how they can be affected, but one of the main things that people don't realize is that sometimes people disconnect their mouth, their head from the rest of their body, and that is a shame, because really it's all the same bloodstream, so it's like people think, oh, this is not connected to the rest of my body. Well, it really is. So we have millions of bacteria in our mouth, and that seems like a big number, but it's true. Within our body we have good bacteria and we have bad bacteria. So the main goal, like when we're talking to kids at school, the analogy I give is like, okay, you wash your hands during the day, right? And they're like, right. And I was like, why do we do that? What's on our hands? And they say germs. And it's so you can't really see them, but they're there. And it can be the same way in your mouth. Although if you have a lot of buildup on germs on your teeth, you can see it because it's like a white sticky substance that's on your teeth. And that's what we brush off with our toothbrush. So like with hand washing, we wash our hands with soap and water to wash away the germs, the majority of them. And in our mouth, we brush away the germs that affect our teeth and our gums. So there's like certain types of bacteria in our mouth that cause cavities, which are holes in our teeth caused by germs. And then there's certain types of bacteria that cause gum disease. Like when your gums are swollen and red and puffy, it's called gingivitis. And that's the first stage of gum disease. Periodontal disease is the same name for that. And so the goal is to reduce the amount of bacteria, the bad bacteria, as much as possible to eliminate those things from even starting. And so that's why it's so great with, I love that we see little kids early on in the early ages, we can teach them. And right now, we're actually seeing pre-K students too, where before, all these years that I've been doing this job, it was just kindergarten through 8th grade. We don't go to high schools anymore. So like when we see them, it's just now pre-K through 8th grade. And the reason why we see them from beginning to that point in time is because Like with the little pre-K people that we're seeing, the majority of them don't have any permanent molars in the back that have grown in, but they have all their baby teeth. And so those baby teeth are prone to cavities. And so we want to start at an early age to teach them about taking care of the teeth and how we do that. And so just the basics that we teach are, when you're brushing your teeth, you want to brush for at least 2 minutes. That sounds like a short time, but it's really not when you're like having a timer going and you're like brushing. Because we have with our little kids, we have like a little bear that has a 2-minute timer, but it's not a timer, it's a song that the bear sings. And so we have the kids pretend like they have a toothbrush and try to brush, along with it, and they're just like getting so tired because it takes a long time for 2 minutes. But when you're doing that, you're more likely to remove that bacteria that's causing a potential decay or gum disease. And so, so basically brushing twice a day for 2 minutes is a good, healthy start. The other thing that we recommend is that you floss your teeth with dental floss once a day. I usually do this at nighttime before I go to bed. And that cleans in between the teeth where that bacteria hides that your toothbrush can't reach. And so the floss is super important. And people that tend to have what we call periodontal disease or gingivitis, it tends to begin in between the teeth where your toothbrush can't reach. And so, and people are more prone to brush than they are to floss, but it's really the combination too that will keep your mouth healthy. And so that's just super important that you are brushing and flossing, that everybody needs to brush and floss twice a day, floss once a day. And so, and just using like a pea-sized amount of toothpaste on a toothbrush is all that it takes. It doesn't take a whole slather on a toothbrush. And for like little tiny people, it just takes like for little bitties, just like a little grain of rice size of toothpaste when you're brushing in there. So, but your kids are older, so they can use a bigger size. So those are the basics with that, because that's just like the basics of what we need to know, what's causing these oral diseases, and that's what decay is. It's actually an oral disease, and it's bacterial based. And so that's just kind of the start of that. And so, like I said, people tend to, disconnect their mouth with the rest of their body. The thing is that when people start presenting with maybe like gum problems, there can be a connection of that with having like diabetes or leukemia. Bacteria in your mouth can affect heart disease. All those things are actually interchangeable, they're related. And so it's because the bacteria that's in our bloodstream that goes to our heart, it can affect your heart. And so it's just good to know that just for overall health, we need to take good care of our oral health. When it comes to dental decay, one of the main things that we have to really watch is our intake of sugar. And that can take different forms. It can be just straight out candy, it can be straight out of Coke, but actually it has to do with what's called carbohydrates. So if you can think about processed foods like chips and things like that, if we are snacking on those things during the day, it increases our chances of decay, because the bacteria in our mouth feeds off of sugar, and carbohydrates they convert into sugar when we have them frequently. And so the bacteria tend to multiply, and they do their bad job when we have lots of sweets or carbohydrates. So for a woman that's expecting, a pregnant woman, it's super important that they eat a well-balanced, healthy diet, not just for themselves, but for their baby, because the nutrients that we intake affect the nutrients that our baby will intake. And so it's really important to eat good, healthy foods, we call whole foods, which involve like going into the produce section, just making sure that you're eating lots of vegetables and fruits and things of that nature. And then good, healthy foods like milk and cheeses and yogurts and things like that that have calcium, high calcium in there, that helps our bones and our muscles to grow and for the baby to grow strong. And so really the key is just kind of, with pregnant women, they just need to really watch their intake of that snacking throughout the day, because they tend to eat, I know I did, I just craved certain things that were not necessarily good for me, that can affect your oral health and your overall health for you and your baby. And so So increasing snacking throughout the day increases your chance of cavities, and so that's one thing to be aware of. And so also, ladies that are pregnant, it's good for them to go to the dentist even actually more frequently than we recommend going to the dentist at least twice a year, every 6 months to have your teeth checked. Maybe having your teeth x-rayed once a year, and that helps to check between the teeth where cavities can start. But for when pregnant ladies, it's really kind of good. Pregnant women tend to have more increased chance of gum disease because if they're not feeling well, they may not feel like brushing their teeth because they're nauseated and things like that. And then they're also eating more frequently and things that can affect the gum tissue and the teeth. But it's really important for them to go to more, probably like 3 times during their pregnancy to the dentist, just to have things a close eye on there with their gums especially. A lot of people experience pregnancy gingivitis, and so sometimes that's an issue. And if a dentist has to take an x-ray during you're pregnant, they have like a lead apron that they cover everything, the baby, everything. So if there's x-rays that need to be taken, it's safe to do that. So people ask about Diet Cokes, and Diet Cokes, they have a sugar substitute in it, but Diet Coke is really high in acid, and acid is not good for what we call the outer layer of the tooth. It's called enamel. And so if we have frequent intake of Diet Cokes even, it can actually cause the enamel to be weakened, and because the acidity of the Coke itself, the Diet Coke. So that's just one thing I just want to throw out there, because people are like, why should I Diet Coke? It's like, well, it's good because it doesn't have the table sugar in it, but it still has high acid in it. So that's just one thing to be aware of. So when the baby is developing in the mother's womb, the baby at, I'm trying to remember what age it is, it's like when they're 4 to 5 weeks old, there's already like the baby buds present while the baby's like forming in the womb. I think that is so amazing to me. So their teeth are already forming at that stage within the uterus, and so I think that's just really cool. But that's why it's so important that we ingest good nutrients for our babies so they can grow healthy and strong. And so, but when the baby is born, of course, they don't have teeth right away. But as they grow, generally by age 1, they will have a tooth that's come in, maybe before this, sometimes 9 months, and babies can grow their teeth in a little bit earlier, just a few of them. So when that happens, it's just real important that we go ahead and start doing oral hygiene at that point, even if one little tooth is broken through the gum. And so what is recommended, when that tooth breaks through, you can actually start, brushing that tooth with the toothbrush. Maybe not the toothpaste yet, because they can't spit out the toothpaste, but even if you did, when they have more teeth, even just a tiny bit will not hurt them. But it's good to maybe get like a little washcloth and rub that tooth or a little gauze and make sure you're cleaning out that tooth. And when the baby's by age 1, it's important to go ahead and have that baby checked at a dentist, just so they can start just look at how the mouth is forming and just see those teeth that are starting to erupt. And by age 3, they will have up to 20 what we call primary or baby teeth. And so they should have by then, their full set of their 20 primary teeth. When we start seeing the little kids in school, the little pre-K, like I had a little 4-year-old, they had all their baby teeth, and I actually saw one today, and she already had like 8 cavities in her baby teeth, and it breaks my heart, because it's like, okay, well, what's happening here? And more than likely, that child probably was either given a bottle when they went to bed and just let them sleep with the bottle, or they napped with the bottle, or they have a juice cup with juice in it and they're sipping on it all day long. And so that should, even though juices don't necessarily have like table sugar added to it, there's natural sugar in it. And so that in combination with the bacteria in our mouth that we talked about, that's what causes the decay process. And so people do wonder, well, how does that happen? Like, going back to when the baby's a newborn or whatever, how does that baby have that bacteria? Well, the bacteria in our mouths can't be just transferred one another. Like if I'm like coughing or something, that's not the type that they're talking about, decay and cavity producing with that type of bacteria, or the periodontal disease bacteria that's talking about. But it can be passed from mother to child. So say the passy falls on the floor, and I'm like, a 5-second thing, you know, like, okay, it's 5 seconds, let's just pick that back up. I'll just put it in my mouth and then put it in my child's mouth, you know. You're transferring that bacteria to your child. So that actually can take place. And so you don't want to do that, you know, taking a spoon, licking it, or handing it to your baby afterwards. That can be the transfer of that particular bacteria to the child. And so it can be transferred. So, but that bacteria, like I was talking about, this little child had all those cavities. And so my guess is that it was probably due to a baby bottle with formula milk in it, or breast milk. It could be either, or juices that they're sipping on all day during the day or at nighttime. So that's what we recommend, is that not to happen. Breastfeeding is real good because it's on a schedule. But even still, if someone's breastfeeding, it's still milk and there's natural sugar in it. So those kids still need to have like the oral care of like brushing or wiping off those teeth, you know, to get off that plaque film that starts the cavity or the decay process. So when I was talking about those little kids that we're seeing, they're like 4 and 5 years old in pre-K now. That's why we like to try to start talking to them how important it is to take care of our teeth. Because I asked them, like, okay, can you imagine eating your lunch without any teeth? And they're just like, you know, that would be really hard. And so we need to take good care of our teeth, because our teeth take good care of our body so we can eat good, healthy foods so you can grow strong and big. And so they're like, oh yes, you know, to grow big and strong. And so we talk about that. And so we talk about how long we need to brush and about flossing. And so when we give the kids little goodie bags at school, they all get like a new toothbrush and some toothpaste. And these are some little flossers that we give the kids. And these are great because they have little handles and they can just floss their teeth themselves. And so these are really great. And actually, there's ones for adults too, that if you have a hard time wrapping the flosser on your fingers to get the back teeth, there's Glide is the brand that has flossers like this for adults, and they're great. My husband likes them. So, but they get we give them little goodie bags that has their new toothbrush and everything, and floss and toothpaste. We also give them like little stickers and some pencils, and we actually give them a little sugar-free sucker too, and they love that because they're like, oh, it's candy. It's like, well, this is good for you because it's made it's called xylitol, and xylitol is a sugar substitute that's actually known to actually reduce the chances of cavities, which is really cool. So there's been research done about that. So those are the things that we give to those kids. So like I said, a child needs to see the dentist for the very first time when they're 1 year old. And then it's good for them at least to go once a year, if not twice a year beyond that. And that way the dentist can really keep an eye on the teeth and making sure there's not any cavities that are starting. They also can see how their mouths are forming. Sometimes you can have kids that tend to suck their thumb, or they used a pacifier for quite a long time. I know when I had to break my son of that when he was little, that I remember how traumatic it was that we stopped him giving that pacifier. But it's the sucking process, if they do it too long, it actually can malform the mouth. And what happens is those, the way the teeth are positioned will guide in how the permanent teeth come in. And so that kind of leads to something that I was wanting to mention as well. You know, people ask, some people, they ask about, okay, well, my child, like this little girl that I had today, and she ate cavities, and they're all in their baby teeth, and they're like, well, it's just their baby teeth, they're gonna lose them. It's like, yes, but if you have active infection in those teeth, when that child gets older, if it's not dealt with now, if they're small, it can affect the permanent teeth once it starts to erupt. And so it's important that they go to the dentist and they have the tooth repaired with, if it's either a filling or like a silver crown or something. And what that does, they remove that bacteria that's causing that, so it stops the decay process, hopefully. But that bacteria is still present, so we still have to do the oral health care, at home. It's just good that they go regularly to the dentist so that they can check their teeth. Number one, they can take x-rays and they can see when your kids don't have all your permanent teeth in it. The x-rays help see where those new permanent teeth are. And the doctor can tell the relationship between their top teeth and their bottom teeth, how they're coming together. That's called their bite. You know, this is just a little tooth model of a little person that has, they're just the baby teeth. But when they can look at the way the top teeth are related to the bottom teeth, and there can be different signs that the doctor can see that, oh, the relationship with those teeth are not in the best position, you know, for long term. And so the goal with braces, of course, it makes people's smiles more aligned and makes them beautiful, you know, once they're lined up. But people do braces for aesthetics, which means it makes their smile look pretty. But really, my goal for when I would see patients in the office is for them to understand the reasons behind it, about the functionality or the functions of their teeth. Because when you have the top teeth that don't have a good relationship with the bottom teeth, it can affect how you chew. And it can put pressure, if you're biting more heavily on one side, or if you're biting more heavily on the front, it adds pressure to those teeth, where long-term can lead to fractures of teeth down the road, or discomfort, or actually this is even still, it can affect the health of their gums and the bone support around their teeth. That sounds really weird, but I've seen it time after time, how people's bites can affect just long-term as they develop into an adult and later in life. So going to the dentist regularly is super important about that, and they can see those signs of like, yeah, you really probably need to go see an orthodontist who's the braces specialist, and so they can determine, okay, this really would be more beneficial for your child. With braces, they're great because they make your teeth straight, but it's more for functionality of your teeth in the long run of keeping your teeth healthy, and so it prevents fractures from happening and things like that, and wear and tear on certain areas of a tooth that didn't necessarily have that, it was designed for that pressure.